Like any other living tissue, heart muscles need blood and oxygen supply for their normal functioning. The blood vessels that supply blood and oxygen to the heart muscles are known as coronary arteries. Cholesterol deposition on the wall of this artery is called plaque. Formation of plaque in the blood vessels causes narrowing of the blood vessels. This can affect one or more arteries. When the arteries get narrowed, they are not able to supply adequate amount of blood and oxygen to the pumping heart. This lack of oxygen in the heart muscle causes chest pain or angina. When arteries are narrowed in excess, or when a blood clot forms on the plaque, the artery may become completely blocked, causing death of a part of the heart's muscles. This is known as a heart attack. What is coronary angiography? An angiography is a reliable procedure to detect the narrowing of blood vessels. It is an X-ray visualization of the heart's blood vessels. During an angiography, a flexible tube called a catheter is inserted through the blood vessel of the thigh or the arm towards the blocked segment of the heart artery. A dye is injected through the catheter so that X-ray images of the heart's blood vessels can be obtained. If the angiography does not show a blockage, the patient is allowed to go home after the test is complete. However, if the angiography shows blockage, the doctor may perform a coronary angioplasty after visualizing the details of the block. What is coronary angioplasty? Coronary angioplasty is a medical procedure which opens up blocked blood vessels, thereby restoring blood flow to the heart's muscles. Coronary angioplasty may be needed to reduce chest pain caused by reduced blood flow to the heart's muscles, minimize damage to heart muscle from a heart attack. This procedure is sometimes done as an emergency procedure after an angina or heart attack. Preparation before a coronary angioplasty. Follow the instructions regarding the intake of medications as directed by your doctor. In preparation for the coronary angioplasty, your doctor may stop or adjust the doses of the regular medications several days prior to or on the day of the procedure. Be sure to tell your doctor if you have had any allergic reaction to any substance or drug or have any history of bleeding problems. Pre-procedure tests like chest X-ray, ECG, blood examination are scheduled before the procedure. You will be asked to sign several consent forms stating that you understand the procedure and are ready to comply with the medical team for the same. What can you expect during the procedure? The patient is relaxed with a mild sedative before the procedure. The area from where the procedure will be started, usually the thigh or the arm, is shaved to remove hair and prevent infection. The area is cleaned with a special antibacterial agent and covered with sterile drapes to prevent infection. A numbing medication, local anesthetic, is injected into the skin over the blood vessel of the thigh or the arm. This may feel like a mild sting, which lasts only a few seconds and will keep the area pain-free. The blood vessel is punctured with a needle and a thin guide wire is inserted into the artery and advanced towards the blocked segment of the coronary artery. Then, a long, thin plastic tube called a catheter is passed over the guide wire towards the blocked segment of the coronary artery. A deflated balloon is placed at the tip of the catheter. After the tip of the catheter reaches the blocked segment of the heart artery, the balloon is inflated. With the inflation of the balloon, the plaque is flattened and the blood vessel is opened up. The balloon is then deflated and removed. When the catheter is removed after the procedure, pressure is applied at the site of the catheter insertion to ensure there is no bleeding. After the angioplasty, there is a risk that an artery will become blocked or narrow again at the same site. In order to keep the blood vessels open, doctors use a device called a stent. What is a stent? A stent is a tiny, slender, expandable metal tube that fits inside a blood vessel once the blood vessel has been widened. To insert a stent, the doctor removes the angioplasty balloon catheter and inserts a new catheter on which a closed stent surrounds a deflated balloon. The stent-carrying catheter is advanced through the artery to the site of the blockage. The balloon is inflated, causing the stent to expand and fit on the inside of the artery. The balloon is then deflated and the catheter withdrawn, leaving the stent in place. The stent is left in the blood vessel permanently to keep it from closing up again. What can you expect after the procedure? After the procedure, the instructions regarding the medications, care of the wound site, resumption of physical activities, etc., given by the medical team should be understood and followed carefully.